Hi, and welcome to the first recording of Moxie's podcast called Full Potential. The whole purpose of this, we're kind of rolling with it and trying things on, seeing what you guys are interested in. The whole purpose of this podcast is really to be educational, open dialogue. We see things on a clinical level where people are interested in asking questions when the doors are closed. And so we have just kind of taken note of those things over the years, both in my women's health realm, in the aesthetics realm, weight loss realm, sexual health realm. And we're just going to kind of throw it all out there. We'll see where it goes. Maybe people are interested in very specific questions outside of what we see in the clinic, and we'll bring those into the podcast and take it from there. But I think we just need to kick her off and talk about the spicy stuff first. And today's episode is why women don't have to settle for low libido. So we're definitely going to kind of brush on who we are, both individually, collectively as a med spa, but we're going to kind of get right into it in the women's sexual health realm and open that conversation up, because why not?
So I feel like the perfect question is, why don't you introduce yourself? What makes you kind of a, expert in this realm and women's sexual health?
Yes. So I'm Alex Foley. I'm a women's health nurse practitioner, certified nurse midwife, started working with women 15 years ago in a nursing capacity before I went back to school, but women's health has always been my passion. So although I started my medical career in critical care, I quickly transitioned to women's health. I've been in the Milwaukee area in some capacity of women's health for the last decade plus, and the last 5 years have been spent specifically in obstetrics and gynecology. I practiced in the inner city and delivered babies at the hospital here locally downtown. And I think midwives automatically assume people are just delivering babies, taking care of pregnancy care, all of that stuff. But we really do see full spectrum gynecology. And so what I would see, again, back to that thing, like what we experience when the doors are closed,
Absolutely.
people would come in for GYN visits in the whole life spectrum, 30s, 40s, 50s, 60s. I was taking care of everybody. And women's sexual health always was one of those things that people would ask me about, because who else do you ask? You ask your women's health provider.
Exactly. Yeah.
You're not asking
the expert.
You're not asking your 60-year-old male GP that you see for your annual blood work, right? It's not always the most comfortable conversation.
No, it's not.
But I realized I didn't have a lot of answers for them. And then I looked at my colleagues who were amazing in their field and great GYN surgeons and great obstetricians and really good clinicians, but they also didn't have the answers for it.
So there's this gap missing where nobody really had the answers.
Exactly. And it's very uncomfortable for me. I'm such a data girl. I love data. I want to be the best at what I can do. And I really struggled personally and then subsequently professionally with not having the answers for women. And it was enough of a trend where I'm like, shit, who's taking care of this?
Absolutely. Yeah.
So I actually went back for a lot of extensive training in hormone replacement, perimenopause, natural women's aging, women's sexual health. I will do men's health as well here, we see men for aesthetics, weight loss, hormone replacement. Yeah. But my bread and butter is women. It always has been and always will be. So I really feel like I sought that knowledge. And I want to make Moxie not only a place where women can feel their most confident aesthetically with our aesthetic services, but also a place where we're bridging the gap in women's health and women's care.
I love that. I feel like there's not a place here, locally. I mean, yes, you have your OBGYN, you have your primary, maybe you go to a med spa, but there's not a place that pulls it all together with the extensive knowledge that you have.
Yeah.
So I feel like it's perfect.
I mean, we always talk about we have amazing patients.
Yeah.
And I think part of that is just we have spent a lot of energy and time cultivating an environment of safety, and we have a no pressure sales technique, even with our aesthetics. We're here to meet you where you're at. So I think the general philosophy here feeds into the women's sexual health realm, almost seamlessly.
Yeah, no, it does.
It's not easy conversation. It's not easy to bring up. It's not easy to take your pants off for someone. For these procedures. It's not easy.
I get it, but I feel like when you trust a provider, you know that they only want what's best for you. It becomes easier.
Yeah.
And
conversational.
Exactly.
And then let's find a solution.
It just kind of comes up and we will fix it.
I love you. Let everybody else love you. So that's about me. What about you?
I've been an ICU nurse. I've been a nurse for over 15 years. I've been in the aesthetics industry for the past decade. Kind of started off doing skin, all lasers, moved to Dallas. In Dallas, I definitely learned more injectables, more skin. Definitely took my whole career to a whole nother level, being in a very fast-paced city where everybody's getting something. And then we moved back here. This is where I'm from. And then here I am.
I think a few things you're maybe underselling yourself on. You are the type of laser, yes, you're a registered nurse. Yes, you have that good clinical background. But from just the laser technician standpoint alone, like you got to train under one of the best in the country and you get to bring those protocols.
Oh, I did. Yeah. In Dallas, I got lucky to be the director of where I was working. She was also a Seitan trainer. And so not only did I learn originally when I started my career from the best and she retired, I then in Dallas learned even more so new protocols, new standards. I mean, really just being able to treat every kind of skin type and learning injectables, you know, under them as well. And so I feel like it bridged my gap of knowledge where I was able then to do everything.
Also, the fact that you were in Dallas. So some people maybe can or cannot appreciate this, but we are a different industry here in the Midwest.
100%.
It's why we're really moving forward with like, hey, find your Midwest Moxie. We are geographically unique. We have unique personality traits. We have unique spending habits. You know, some people say we're a few years behind the major cities, but we also are eclectic in different ways. There's pros and cons to that.
It's different, yeah.
But with you at Dallas, like Dallas, New York, Chicago, LA, Miami, is really a leading forefront for aesthetics. And people invest in themselves there. And you
100%.
Yes.
Everybody's getting something. Everybody's spending the money to invest into themselves. Looks are very important. Yeah. And don't get me wrong, I think people care about themselves here as well. We're in the Midwest. It's it's very different. And
but you get to bring those skills.
But I did.
You got there.
Yes, absolutely.
Like,
but also take my
take
on it because, you know, in Dallas, you know, there's a whole like bigger is better. Now it was a little difficult for me, honestly, you know, because I like more of the natural look. I think less is more. Like, what can we get away with? You know, I always say we're going on a journey. This is not a sprint. Like, I just want to make the best care plan for everybody that I meet. And so, yes, learning all that was incredible. But now, like, taking all those skills that I learned and bringing them here, to me, that I'm very excited about.
Yeah. That leads a little bit into our philosophy here at Moxie. Less is more. Yeah. It takes more skill, patience, and understanding, both from a actual physicality skill set and a mental skill set, to make people look polished, elevated, on a level that isn't overdone, overt. And it's not that we're like, I love when people are fully tatted, when they have big aesthetic things. That's fine. Yeah. It's not what we do here. And so we are for the people that want that more luxury, polished, elevated look without...
They want to look fresh without looking overdone. And I feel like that is our definitely main philosophy in the way we do business here.
And partnership, which makes also the sexual health component like easier.
Yeah, a little bit of everything.
Yeah.
I feel like on that note, I feel like we should just dive into our topic today.
Spicy.
So let's talk on why women don't have to settle for a low libido.
Yeah, libido is an interesting topic. I think women's sexual health in general isn't always talked about. I think it's been... I don't want to use the word poo-pooed, but again, back to like, we don't know what to do with it. And then also women as a nature, we just tend to be in phases of our life where we put everybody else first, whether that's kids, and then we have aging parents, and then we're taking care of our parents, and so on and so forth. I think libido...
like, how would you define a low libido?
So if we're going to get into the nuts and bolts of it, it really is... It's more than just a lack of desire. It is persistent distress to the point where you're losing yourself, your confidence. You want this, you know, but you
don't quite feel yourself.
So it's desire and libido are intrinsically very similar. They intersect and cross a lot, but they are different. And it is important to make that distinction because, like, for instance, somebody maybe came in 55 years old for a GYN visit for me an annual, and I'd be like, how's your sexual health? They're like, I'm not having it. I don't want it. I'm good. There's no, they're not distressed by the fact that they have no libido. But that is not everybody's situation.
But I feel like the
scenario.
people that come, they are a little distressed about it and they want to feel like themselves again. And I feel like that's where we can come in, you know, and kind of help with that.
And libido, there's ups and downs, like peaks and valleys,
Yeah.
and there needs to be respect for the fact that it is multifactorial. There's going to be periods in life that, you know what I mean, it waxes and
Absolutely.
wanes.
Would you say a low libido is just part of getting older?
No.
I know. Okay.
Well, yes and no. The hormonal shifts that happen in perimenopause and menopause, even honestly after childbirth, I know there's all this conversation about perimenopause and hormone, but what's happening to women's bodies, you know, just even in their 30s, progesterone is starting to decline. Life is busy. Relationships are stressed from kids. So no, I don't think it's necessarily something that we need to settle for.
Okay. No, I like that. What are the most common root causes of low libido in women? I know you kind of touched a lot, you know, on it, but like, what would you say? Like, like stress, sleep. I know those are a lot, you know.
There is some medical things to keep in mind too. So we're talking about optimization and vitality, but we, you know, part of having an experienced women's health provider is also you do need to eliminate some true medical reasonings for it. Yes, there's the hormonal shifts, but things a little bit more concrete, thyroid disorder, certain medications, particularly like, I hate to say it, I love birth control because I love the idea of women, you know, women's rights and all that jazz, but like birth control is a main factor as well, blood pressure meds. So there are some medical things that need to be eliminated when we're having this macro conversation. But when we're talking about the things outside of that, hormone shift is a big one. Stress
is huge. I mean, I know myself, if I'm stressed out, like I'm good. You know, I mean, that's a lot of women. I feel like we're very more psychological, where men are a little different. You know, for women, it takes more.
We're sexually responsive versus sexually forward, you know. So there's a difference there, and we can get into that deeper. But another component is relationship stability and satisfaction in your own relationship, emotional safety, those sorts of things. So when women come in and we're talking about women's sexual health, I'm like, I can do these super cool things and use these super cool modalities like the O-Shot and HRT and talk to you about where you're at in your life and, you know, help with your weight loss or your physical, but if you are in a relationship that doesn't meet
and satisfy your
needs in some capacity, or you can even be working towards mutual goals. Maybe it's not perfect. No relationship is perfect. But I can't fix that. So there is a limitation to the conversation, and
makes sense.
I don't steer away from that conversation either. Like, tell me a little bit about your relationship. You don't have to say anything you're and share anything you're
kind of like see the big picture. No, for sure. Why do you feel like women are blamed for having a low libido? I feel like I hear that a lot. You know, it's on the woman.
Well, I think we're trained to think that libido is like spontaneous, and desire happens on its own and effortless, but it's not that way for women. It just never has been that way. And I think when those dynamics are different, the solution becomes different then. And then we blame ourselves because like the baseline is kind of this, I want it, I get it, I'm satisfied, life moves on, but it's, I don't know. That's a hard one.
It is a hard one. But I feel like it comes down, you know, where the woman's like, well, there's something wrong with me. When, you know, there's a lot of factors in it. We talked about it being psychological, hormonal. I mean, there's so many factors in it. So I would say kind of, you know, we talk about it, but what we do here, we have a lot of hormone replacement. So how would you say hormone replacement helps with libido? Like, what do we offer that can help a woman with that?
Everybody wants to talk about estrogen as we get older, right? Because it creates these systemic effects like hot flashes, weight gain, all the obvious things. They're like, oh, I watched my mom go through it, my grandmother go through it. That is the hormone primarily responsible for that. But we start having hormone shifts in our late 30s, some people even their early 30s. And then we get like our PCOSers that have other complexities. But anyways, progesterone is the first one to decline. Testosterone starts to decline in our late 30s, early 40s. Estrogen's actually the last one. So as we look at the life continuum and what is this drop in this equitable state of these hormones. That is a very important part of the conversation. And that's where the HRT comes in.
Yeah.
And we get baseline assessment on people. We look at their ratios. We look at how they're feeling, sleep patterns. There's a lot that gives us information about where your hormone status is based off of these very nuanced symptoms.
So even like myself, you know, I felt different, not my usual self. And we got blood work done on me and my testosterone was low. And so now I'm supplementing it and I feel like myself again. So like, how would you say that testosterone plays, you know, like a part, like what?
Energy, vitality, just even mental stamina. I think we think about testosterone as like male.
Yeah, I know. That's what,
building.
yeah. I mean, everybody, my
I
mom, my friends, like, why are you on testosterone? Is that for males? I'm like, no, like we produce it
such
too.
A small amount compared to men. So there is that discrepancy. Like we need but we need it.
Yes.
We need it. And usually when we supplement women's testosterone, yes, there's some sexual health benefit to it, but there are no afternoon slumps. You know, they're firing a little bit sharper than they were.
Definitely felt that.
Yeah, just energy sustainability.
I like that. Why do you feel like women, I mean, we kind of talked about a little bit, but why don't more women talk to their providers about low libido? And I feel like we did kind of touch a little bit about that, you know, just that stigma, maybe a little bit of it.
Yeah. I think the number one thing that I hear people come in and say, because by the time people are talking to me about it, it's usually like, I've talked to 3 providers already.
And that's
my
what I
OBGYN,
feel like.
PCP,
And like I don't have an answer. And so then,
it's normal.
Yeah.
You're 45, you're 55, you're menopausal. It's a lot of shifting the conversations towards normalcy and acceptance versus like, this is distressing to me. This is a part of my identity. This is part of my relationship. This is a part of how I interact with myself and the world and my partner potentially. So I think it's not necessarily purposely dismissive, although I do think in the medical community in general, we're so used to having the answers. People come to us, they want the answers, but sometimes we don't have the answers. And instead of looking at our patients in the eye and being honest and being like, I don't know.
They kind of like make something up in a way, just to kind of like they don't want to. Yeah. And I feel like, it's just knowledge. And what I see you do, I feel like compared to maybe other providers is you seek the answers. You're not going to just settle where, okay, well, this is what we do. This is normal. This is a part of life. Like, no, it's not. What else is there? And you do such a good job about just the research, what's new, what's trending. Like you're always on top of it.
Yeah.
I feel like
I'm super fascinated with human nature in general, but I can't help how my brain is wired.
Yeah.
Like,
no, but
I'm like a research. I just give me all the data points, give me all the knowledge.
Absolutely.
And then let's tie that into human nature.
Though, you know, because you don't get it. It is fascinating, but I feel like people don't, you know, as providers, they're kind of stuck, you know, in the past a little bit where we have so many patients that come in and they're like, well, that's not what my OBGYN said. And you're like, oh my God, like that is such old data, you know, like move on. There's more up-to-date information out there.
It's a delicate balance because a lot of these women's health providers in our area were my colleagues,
absolutely.
and they are actually a wonderful clinicians.
Yeah.
So I always tell my patients, like, they're great. Some of this is just, I'm hoping in 10, 15 years, this is standard education level for all OBGYNs.
And the gap will be bridged a little bit more.
Yeah. So I think we'll get there. I'm hoping. I definitely have noticed a trend socially that opening the conversation up about perimenopause. There's like Halle Berry and other celebrities are really like hosting round tables with other women their age. I'm like, I see it. Yeah.
And I feel like, the more women talk about it openly, other women are like, well, I'm experiencing that too. It's not this taboo topic that's talked about. I feel like more people are open, you know, talking about it.
And it will drive clinicians to have to learn about it.
What do you feel like the biggest myth is about the female libido?
I would say that it's spontaneous. Like it is just more mirror. I think we compare ourselves to men.
Yeah, because I always hear that like men are just more sexual than women.
That's not true.
No,
that's not true.
Like I don't agree. Yes,
our sexuality manifests in how we carry ourselves, how we interact with ourselves, how we interact with even other women, even as a heterosexual female. Like it filters. It's my dad always made a joke that men have boxes, right? Their family, their work, their relationship, their sexuality, and men are more comfortable with their boxes. Just if they never touch, they never touch, but we can manage it all and do
great. Check.
But women's boxes are like recycling day. It's all over the place, right?
I feel like it's even like wires. Like you think about all these, you know, like wires that are just like connected, and you know, it's
when
a lot
you see a woman who is comfortable in her own sexuality, it translates to how she carries herself.
100%.
How she interacts with the world, how she respects herself.
Yeah.
It is an elevated sense of being. Femininity and sexuality is so powerful. And I don't mean that in a manipulative way. I mean that in a true definition of full life fulfillment, knowing our actual potential
and our worth. And I know.
And that filters on. Then you take that into the bedroom.
And especially when a woman has a partner that's also giving and, you know, allowing them to be feminine and, you know, kind of fueling her needs, then it's just a powerhouse. And, you know, it's a lot of play together for sure.
It is. And I hope that opening the conversation with my female patients also opens the conversation for her and her partner to have this, because I do think an open dialogue interrelationshiply, if that's a word, is really important as well. Just like good communication. So yes, let me teach you about how we can use PRP for these sexual health procedures, but let me also encourage you to have these conversations in your partnerships as well.
So kind of low libido, we have ways we can help. Hormone replacement, another thing that we do here, which we'll touch on in a couple minutes, our O shot, but we'll get to it. But what is one thing, as we kind of end this libido, you know, little talk, what is one empowering takeaway? So for, you know, women listening, what is one thing that you can tell them?
Your libido is information about your full comprehensive status. It is a vital sign almost. I almost want it to be like the new vital sign. If your libido is there and you're feeling good sexually, and again, maybe that's just sexual responsiveness. You're not out there seeking it, but when it comes at you, you feel fulfilled, right? So having some flexibility in there, but it is not a luxury. It is part of your identity. And that is the takeaway I want women to have, because when, again, taking it back, when you see a woman that is in her full self, or even
Beautiful to see. I know. I know. It's amazing.
We're women's women. Like we want to see.
Yeah, we're a girl's girl. Yeah. Yes. It's amazing. It's a beautiful, beautiful sight.
We are strong women that love other strong women.
Yes. 100%.
And part of that is just appreciating all that goes into that. And libido is such, it's such a portion of that. Like it's that driving force.
It is. All right. I think that's all on libido for today. I think it's time to.
We could honestly talk about it for hours.
I know we can, but I feel like people will get tired of hearing like libido. Okay, we get it. Like,
yes, but I think it's a good start.
It is. Yeah.
We'll welcome questions. I think we'll expand on this as we go on, but this is a good generalized introduction.
I think so too.
Yeah. You can follow us on social media, all the typical Facebook, Instagram, YouTube, links are below. Book an appointment at moxiemedispa.com. We have online booking to make it as simple for our busy people as possible. Christy's at our front desk. She is.
Give us a call.
Yeah, give us a call.
Yep, she'll take care of you as well. Yeah.
So, till next time.
Till next time.